Your Voice webinar series, which is a series that's sponsored by the California Endowment on how good practice, policy, and research can improve healthcare for culturally diverse populations. Before we get started, I'd just like to tell you a little bit about DiversityRx if you're new to our webinar series. We've been around since 1997, and we work on a variety of different activities, including policy development, research, education, and support to improve healthcare for minority, immigrant, and indigenous communities. We have a couple of different things that we offer to folks to help them in their work. One is our website, diversityrx.org. Another is our listserv called Class Talk, which has more than 1,700 participants. We have a conference series, and our next conference is actually going to be in October this year in Baltimore, Maryland. And then, of course, you're taking part in one of our Your Voice webinars, and the Your Voice project has also included communities of practice and peer learning networks. So I'd like to introduce you today to our webinar, which is about the National Board of Certification for Medical Interpreters, how to prepare for and take our certification exams. We have as our presenter today Elena Langdon. She is the Supervisor of Interpreter and Translation Services at Bay State Medical Center in Springfield, Massachusetts, where she oversees a staff of 45. Prior to working at Bay State, Elena worked as a freelance interpreter and translator, Portuguese and English, for several years. She's certified by the American Translators Association as a translator and holds a Master's in Translation Studies from the University of Massachusetts at Amherst. She's been teaching interpreting and translation since 2005 at several educational institutions, including UMass and Boston University. She's Secretary of the National Board of Certification for Medical Interpreters and Administrator of the Portuguese Language Division of the ATA. She was born in the United States, but she grew up in Florianopolis, Brazil, where her mother and her brother still live. So before I turn the mic over to her, what I'd like to do is just run you through a few little bits of technical stuff so that you can feel comfortable while you're on the webinar. We do allow for questions and answers after the presentation. But because we have so many people on the webinar, we keep the audience muted at all times. And the way you ask questions is that you can use the questions window at the bottom of your control panel. In this case, we only have one speaker, so you don't have to worry about who you want to send the question to. So when you click on the control panel and you see the questions window, you just enter it right into the questions pane, and then we will keep track of those questions. And when Elena's finished with her presentation, we will pass those questions along to her, and she will try to answer as many as she can. Now, typically, we have a lot of people who ask questions, and so we can't always get to all of them, but we do have a way of dealing with all of those extra questions so they don't get lost. So one of the things that I'd like to point out to you is that on the GoToWebinar control panel, you want to make sure that you click on View from the drop-down menu, and that you make sure that Auto Hide the Control Panel is not checked. This will ensure that your full control panel will stay visible for you at the right-hand side, and that will make the question panel readily available to you whenever you want to type in a question. And as I said before, we will get more questions than we probably have time for, but we will be passing all of those questions on to Elena so that she can have a look at them after the webinar, and then she'll try to answer as many as she can, and we'll make sure that you get those back in an email that we send to you after the webinar is over and when she's had a chance to answer them all. Now, one little detail more that I want to point out, we will be posting the slides of the webinar online, and they will be on the webinar page that you originally looked at, which we will be giving you the URL for later on in the presentation. We will also be posting an audio-visual recording of the webinar probably within a week after this webinar is over. So you'll be able to, if you didn't have a chance to listen to the whole thing or you want to pass it along to somebody else, you'll have a chance to see it and hear it as it was done or is going to be done right now. So with that, I'd like to turn things over to Elena and ask her to begin her presentation. Thank you.
Thank you, Julia. I'm very excited to be here today. Thank you very much for inviting me, Julia, and Candace for your support, as well as Brittany, who's working behind the scenes. It's my pleasure to be here presenting today to the DiversityRx audience. I will also be presenting live at the DiversityRx conference in Baltimore. So I hope to see some of you there as well. So today I'll be speaking about the program of the National Board of Certification for Medical Interpreters, going over what our test is like, the timeline in terms of how to register to become certified, and what's really the content of the exam after I talk about how we came up with the exam. So we launched certification in October of 2009, nearly a year ago. I believe October 9th is the one-year anniversary of the launching, and this is at the IMIA conference where we were announced as national board members. And some of the people sitting there that you see are the national board members, and then behind we have many of our supporters, including our founding members, which are the International Medical Interpreters Association. So you have the president there, and Language Line Services is the other founding organization. And the president of Language Line Services is up there as well as president of PSI, which was our testing vendor, and then the other supporters that we've had over the years. We are a board of 12 individuals. It's a volunteer board. We were selected through an open process that was blind, so it was a search. It was a national search was done, and we were chosen not based on our names, but based on our applications and our what we talked about ourselves in terms of contributing. And these are our directors. You can see that we come from all over the country. And I wanted to point out, it doesn't specify here, but we have a board structure with a chair, a vice chair, a treasurer, and a secretary. So Dr. Nelva Lee is our chair. Rita Weil is our vice chair. I am the secretary, and Joel Doherty is our treasurer. We have, as you can see from the list of our credentials, but also just wanted to touch about our different roles and how our board represents all the different stakeholders. So basically, we are comprised of interpreters, trainers, providers, and employers. And there's a pie chart here that shows the percentage of people, although it's not quite realistic because most of us wear multiple hats. So I'm an interpreter, I'm also a trainer, and I'm also an employer. So I count there as one of those, not all three. But that's so that you get an idea of how the stakeholders are represented on our board. And again, there are 12 of us right now. These are some of our supporters with the logos of people that have supported us publicly. And this is a mini progress report. So I wanted to talk a little bit about what we've done since October of 2009. We automated our registration process. In the beginning, we were taking registrations through the mail, but now everything is done through our website. So that's really improved the process, especially for candidates. In January, we started testing candidates, and now I'm really happy to say that we have certified medical interpreters, or CMIs. So that's a reality. There are several people that are now, we have over 80 people that are CMIs, and they're listed in an online registry, which is part of our website. And that was the goal from the beginning, so that anybody around the country, if they want to find a certified medical interpreter, they can go to our website and they'll see their name, their language, when they were tested, and where they live, and I believe their email address, which is masked, but you can find how to enter into contact with that person. Because the board is a certifying entity, we're not a professional association in terms of directing people towards an individual, but it would be up to people to see their list of the interpreters and then contact the interpreters on their own. So as I mentioned, we are registering where people are taking tests across the country for both tests, the written test and the oral test. And we have our oral exam is ready in Spanish, and the next languages they're going to be working on are Russian, Vietnamese, Cantonese, Mandarin, and Korean. And with these 6 languages, the one that we have plus these other 5, it'll cover about, I'm told, 90% of the demand in the country for medical interpreters. And that was the focus. And then, of course, as many of you know, we will focus on the other languages after that. I wanted to briefly go over what it means to be certified because sometimes there still is a little bit of confusion in the field as to what it means. We still hear people saying that they're certified when it's actually something else. So basically, certification is when you go through a standard process. There's a certifying body that says you've met a specified standard, and there's several requirements, and most of the time it does require passing certification exams. And so everybody that goes through the certification process goes through pretty much the same thing. It's not the same thing as completing a course and getting a certificate of completion or certificate of attendance, which could really be anything right now, because our field doesn't yet have any kind of system of accrediting training programs. I believe the National Council of Interpreting in Healthcare is working on this. The IMIA is also working on this, but right now there is no standard even for training. So certification is something that's standard, and in our case it's national. And each candidate should have more or less the same experience as the other, and it's fair to everyone, and you set the base on a national basis. I don't have it up here, but there's a third thing which sometimes people get confused with as well, which is licensing, and that is usually when a state or federal organization, a lot of times the government, decides who can work and who cannot work, so who gets a license to work, and that's a separate process and is not the same thing as certification. So people ask us a lot, well, is such and such a hospital going to hire me now that I'm certified? And of course, we can't answer that question, and that's up to hospitals or states or the federal government really to determine what a license for medical interpreters would look like. And it might involve other things like background checks and whatever else they would think would be appropriate, but we're not a licensing body. In terms of applying for our exams, there are some prerequisites to be able to sit for the exams. Until May of 2011, if you have at least 1 year of experience, that's all that you need to prove. So in other words, until May of 2011, it's a little bit easier in terms of paperwork to be able to qualify to take the exam, not to become certified, but just to take the first exam. And you would need to present a letter from an employer. This employer could be several agencies that you've worked for as a freelancer. It could be as a video interpreter, a live interpreter, a telephone interpreter, the different modalities. It just has to be in the medical field. And it could also be if you're a staff, if you're part-time and it's been longer than a year, all those things would go into a letter that would specify your language combination and how long you've been working there. It's not a recommendation letter. It's really just a statement that you've worked there. If you have less than 1 year, you can still apply to take our exams. The requirements are that you have to, and these two first requirements, are actually requirements for the first case too. You do have to be 18 to apply anyway, and you have to have a high school diploma or equivalent. If you don't have the 1 year experience, or if you're applying after May of next year, then you're going to have to prove also that you have medical interpreter education, so at least a 40-hour program, not continuing education classes here and there, really at least a 40-hour program. And you also have to prove your oral proficiency in both languages. The oral proficiency can be proved in English or the other language through education alone. So if you were educated in one language at the high school level and then you're educated in another language at the college level, then that would prove your proficiency in both languages. If you majored in that foreign language and you took a certain amount of credits in the foreign language for which you're applying for certification, that would also qualify as proficiency, and that would be all that you would have to present. If you don't have the 2 degrees in the 2 different languages, then you can take the ACTFL for the foreign language, and then there's several tests that you can take for English to prove your English proficiency. And on our website, you have the complete list of the different proficiency exams that you can take. They're standard exams. We don't administer them. You take them, and then you send us the results. In terms of the process to become certified with the National Board, it's pretty easy to begin with. You basically register. You can do this online. There's a $30 fee for the processing. Everything can be done online. We really encourage people to do it that way, and also especially to pay online. It's much quicker. The only thing is that people have to remember that then your proof of employment or your training has to be submitted either by email, by fax, or by snail mail if you want, but that is a separate thing. We don't allow any uploading to our website because of technical issues. So there is that second step that a few times we see people forget. Once you've been approved to take it, then you would take the written exam. This is an exam that I'm going to go over extensively in this presentation, but it's all in English. It's a multiple choice exam done on a computer, and you pay the fee of $150. Unless you participated in our pilot exam, which took place last year, then you would have paid $75 for that pilot exam, and you would get that paid back to you essentially. So you would only pay $75 for the written. And right now, if you're a Spanish medical interpreter, then you can take the National Board oral exam once you pass the written exam. And that's $250 for that one, and you pay as you go. You have 6 months in between one and the other if you want to wait to prepare, or because of financial issues or for whatever reason. And then when you pass the oral exam, then you become a CMI, a Certified Medical Interpreter. All you have to do is 5 years later, you have to prove that you have been keeping up with continuing education during those 5 years, proving that you have at least 3 points of continuing education units. And that corresponds, if I'm not mistaken, to 30 hours of workshops and conferences and things like that in the field. You do not have to take the test all over again. This is the timeline in terms of the expected wait time between each one. We have had an avalanche of applications, much more than we expected, and the waiting period has been longer than we wanted. But right now, this should be realistic in terms of how long it takes for us to notify you that you've been approved or that we need further documentation. It should be 2 to 4 weeks. Then you can take the written exam at a PSI location that's scheduled, and I'll talk a little bit about how that's done. You immediately know if you passed or failed because it's a multiple choice exam. So the computer can tell you immediately whether you have passed or failed it. If you passed it, then you'll receive notification as to how to sign up for the oral exam, which will be at a different location. It's with a different proctoring company. And after that, you would be notified in the mail, because it's not done by a computer, within 4 to 6 weeks whether you have passed the oral exam or not. And then you would get your certificate and your card and be listed on our registry as a certified medical interpreter. In an effort to really ensure that anybody who has the skills, of course, and the abilities to become certified can do so through our program, we really don't want to limit it just to Spanish or to 10 languages or to 15 languages or to 50 languages. We really want to have a process that anybody who has the skills and the abilities and the knowledge can become certified through our process. So we're offering 3 different credentials. The main credential that you're hearing about is Certified Medical Interpreter, CMI, and that's going to be for about 30 languages we expect. So those are the languages that we have enough volume and we have enough experts out there that we can design tests, the oral part of the test for those languages, and say that it's a valid, credible credential for everybody, and it has the same weight and strength. Then for languages that aren't as requested in the United States, so for minority languages, we will partner with other national testing providers. And so what that would look like is that you would take our written exam, and then you would take a qualification exam with somebody else that we've vetted as being a national vendor for testing in that language. And then with those 2, you would become a qualified medical interpreter. It has the same exact weight as a certified. All it means is that it's a different language than the ones that we have for CMI, but it's not a different credential in terms of the weight and the status. And then for languages that are really newly emerging, really rare, for which there just aren't any tests out there, and there are very few experts in the field that could actually help design and rate the tests without, pulling all from the same pool, then we will work on a portfolio review, and other countries have done this. So this is what would grant you a screened medical interpreter credential, and again, this has the same weight as the other 2. These are the next languages for the CMI. I'm not sure if you can quite tell. There's a little bit different color there for the next 5 that I already mentioned. This is just an idea of all the PSI locations that we have. There are over 600 locations, and this is the one for the oral exam. I'm starting to go a little bit faster because I realize that I'm a little behind. But basically what our test is like is that you can take it on demand when you want to schedule it. So you don't have to wait until 2 or 3 times a year to travel to New York City or to Chicago or to LA. There are testing centers throughout the country, and you take it very similar to an SAT test or GRE test, for those of you who are familiar with those standardized exams in the United States, where you go to a site and there could be people taking any kind of test along with you. They check your ID, they make sure you don't have anything with you, and you go in and you take the test in front of the computer. We did a job analysis, which I'll be talking about in terms of the content of our exam, and that was the basis for coming up with this exam. So it was a very extensive process. It was done with over 50 individuals that were subject matter experts, and then 3 different groups of people as well, organizations, that worked on designing the test itself, and then going back and forth after the pilot exam that we did for both the written and the oral, and deciding what questions should be kept and what questions should be changed, and what we needed to add to make for a fair exam and a credible exam. We have a validation report that you can access on our website, certifiedmedicalinterpreters.org, in terms of really talking in depth about what this job analysis was like and what we went through in order to create these 2 exams, the written exam and the oral exam. Okay, so in terms of the exam itself, first I'm going to talk about the written exam, which is the first one that you take, and an interpreter with any language combination can take it, because if we don't have the oral exam right now, you obviously don't have the 6-month limit in terms of taking it. So you could take the written exam and then wait to be notified as to when your oral exam is ready. The exam is all in English. It's a multiple choice exam, and it's done on a computer. It's a timed exam, and it's an exam that you can go back and forth between the questions, so you don't have to answer it in order. You can go back and filter it through questions that you haven't answered or questions that you've marked if you're in doubt. So it's very user-friendly. And of course, you can practice ahead of time and take the exam at the site with a fake test, and then you start the actual test. 75% of the exam is medical knowledge, so not translation of terms, not terminology from English into Spanish or Portuguese or Mandarin, but really what is involved in terms of body systems, technology, testing, specialties. All of the topics in both the written and the oral exam are based on the job analysis. So again, this wasn't something that a few people came up with thinking that would be important, but really it was based on what we got in response, the over 1,500 respondents to our job analysis, what they told us that they were doing on a daily basis and what they thought was important for certification, and then checking back in with the subject matter experts, and then piloting it. So all of that, and you can read about that again in the validation report, all about that is that's how the 75% was decided upon for medical knowledge. And then the rest of the exam is roles of the medical interpreter ethics, cultural awareness, medical specialties, the standards of practice from the 3 main organizations that, again, respondents said that they were using, and legislation and regulations. These are some of the subtopics that are covered in ethics. I'm sure if you're a medical interpreter or administrator or a trainer, these are very familiar. These are in the standards of practice that we see out there. And then the subtopics, which is usually when people get a little scared. There are a lot of different specialties here in terms of the medical terminology or the medical knowledge. Of course, you're not going to be tested on every single thing extensively. There are 60 questions on the exam, and you have 75 minutes to take it. And it's a combination of more basic, broad-based questions and then some very specific ones, and they're different, of course, for each candidate, which ones are going to be specific because they're pulling from a large pool of questions. But they are things that, again, we saw in the job analysis that interpreters were telling us this is what we're interpreting for on a regular basis. So here's a sample question, pretty straightforward. You can only answer one, and then move along to the next question. The oral exam, which right now is ready in Spanish and will be ready in other languages in the future, is also proctored at sites across the country using web technologies, also in front of a computer. You have the addition, of course, of a headset with a microphone to be able to take this exam. It's a recorded exam. You listen to pre-recorded dialogue and you record yourself. So you're not watching somebody on a webcam. They're not watching you on a webcam. It's 40 minutes long. It's also a timed exam. There are 12 mini scenarios or role plays, and that's 30 minutes of the exam, and then there's 2 site translation passages. And I'll talk about that in a second, too, in terms of what that is. The subject matter is the same as was done in the written exam, and it's based on the job analysis. So this is the part really where you get to prove your linguistic proficiency in both working languages, your consecutive interpreting skills, your site translation skills, and your knowledge of the medical terminology in the 2 languages, as well as cultural awareness. This is where you, as an interpreter, are really showing what you can do. These are some of the things that are not tested. We've been asked frequently about this. Again, it's based on the job analysis, what was found. We are not testing simultaneous interpreting. So we found on the job analysis that, yes, some people are doing it in some situations. I know our interpreters, some of them here at the hospital where I work, do simultaneous interpreting, and the providers and the patients really like it, and then a lot of patients and providers really don't like it. And some interpreters are very good at consecutive but cannot master simultaneous, and it's not a requirement in my hospital as an interpreter. And what we found in the job analysis, because I didn't design the test, of course, what we found in the job analysis was that really it's too small of a percentage of people that are doing it to be able to test it in this type of exam. Perhaps if it was a higher level interpreting exam, and we would test simultaneous. There's no written translation on this exam either. So at no point do you have to write out or spell out any terms in English or Spanish or Portuguese or any language. And the site translation passages are all from English into the other language because, again, based on the job analysis, this is what was found that interpreters encounter. Every once in a while they might see a medical record that's in Spanish or that's in Russian, but the vast majority of site translation that's being done is being done from English into the other language. It also happens to be what the National Council recommends in terms of the types of documents that you should be doing site translation. We shouldn't be doing consents. We shouldn't be doing long medical records. As interpreters, we should only be doing short instructions and things of that nature, which is the type of thing that's tested. So here's a sample oral exam scenario. So some people would call this a role play. I've even seen it being called a case study. But basically you have a doctor that speaks English, what brings you here to the emergency room today, and then you have the patient that I took uma dor aguda no meu peito, it says it in the other language, and then the doctor, it's a dialogue between the doctor and the patient that the interpreter is interpreting. You interpret after each person speaks. So not the whole thing in a row. It really is similar to what you would do as a medical interpreter. They're relatively short passages. They're not going on and on. And this is a sample. So this is how it would be. You would record yourself. It is timed. And you can ask for a repetition up to 6 times. And the timing of that is really well explained in a document that you get when you pass the written exam and your oral is scheduled in terms of how to request a repetition and ensure that you have the time to do it, because it does count in terms of your time, but you can ask for it up to 6 times, which is more than you usually would in real life. Here's a sample site translation just for those of you who might call it something else. Site translation is when you have a written direction, something written in English, in our case, and you have to orally render it into the other language. So it's not written translation. It's a mixture really between interpreting and translation, because you have a written medium and you go into an oral. So the candidate sees this on their screen, and they have 5 minutes for this, because there's 2 passages, to render this into the other language. And you can re-record it. You can just tell the system that you're doing it again, and you can record your instructions again, and the raters will disregard the first utterances. They'll go with the last whatever you last recorded. So that is, in terms of the exams, those are the basics. I would like to encourage you all to get certified. It's something that you can do now. If you are a Spanish-English interpreter, it's something that anybody can do right now that works as a medical interpreter. Regardless of the language, you can get the process started. We have in the picture 2 of our CMIs, actually, Habib Serrano and Linda Joyce. And really, these are the reasons we think it's important to get certified. Really, it's about you, but it's really also about the profession, and of course, it's especially about the patients and patient safety, and really making sure that our patients across the country are getting the best that they can in terms of communication with their providers. In terms of getting involved, we are looking for raters for our Spanish exam. We are looking for committee members. You can become part of our national board as a committee member, not a director, but a committee member. And we also are looking for subject matter experts in those languages, especially in those languages for which we are planning our next exams, which again are Russian, Vietnamese, Korean, Mandarin, Cantonese, and I knew I was going to forget one. Russian, Vietnamese, Cantonese, Mandarin, and Korean. You can support us by sending us your logo. You can spread the word. We are on, we have social networking covered with Facebook, Twitter, and LinkedIn. And you can see all of these on our website as well. I'm going to go over this really fast. You can get this presentation on our website with the live links on it. But basically, these are some of the resources to prepare. As a national board that certifies individuals, we can't train you. We can, provide all the information on what's on the exam and the way I'm doing now, but we wouldn't be responsible for training you. But we can provide tips in terms of the basics of where to go. So we're not endorsing any of these, but these are some of the very popular places. In terms of finding vocabulary and medical information, medlineplus.gov is a government website. Their translation into Spanish is actually quite good. And they have a lot of videos and diagrams and things like that. For the oral exam, again, we're not endorsing these, but these are 2 that have been used for a long time. CCCS has recordings, ACIBO has recordings, and I'm sure there are other organizations out there as well. Plus, you can find them online and record them yourself, record yourself interpreting, or simple interviews, podcasts, things like that would be really good practice for the oral exam. We always encourage people to join their local associations, their national organizations, and really keep up with what's going on in the field. And here are the regulations and the guidelines that are tested. So you can go to these websites if you're a little rusty on those. Cultural awareness, so there's several sites, of course, DiversityRx being one of the main ones. And here we have some of our acronyms. And I believe that is it. So with that, I will encourage you to contact us if you have any further questions. And I believe we'll open up for Q&A.
We will. Thank you very much, Elena. That was a great presentation. And we appreciate your explaining the whole process and history to us. So as predicted, we now have a lot of questions rolling in, so I am looking at them all, and I think I will start with what might be a very basic one, but I think is an important one for people just to be very clear on. This person asked, do I have to get certification for medical interpreters in order to continue working as an interpreter?
That's a very good question, and I certainly do get that question a lot, even from our own interpreters. No, you don't have to be certified yet. There's no law, and our board has nothing to do with obviously implementing a law. But we predict that in the near future, I would say maybe 5 years, There might be some states that are going to start requiring it. I would think that certainly hospitals and other healthcare medical settings will start to require it once there is a large enough pool, and then they can do so and still get interpreters and provide language access to their patients. But right now, it's not required. It's just something that really, as more and more people sign on, it'll become expected. And then after it becomes expected, it'll probably become required. And I think that's been the case with most other professions that have started certification, including American Sign Language interpreters, but also just any certification process in the healthcare industry. You can't require it until you have a large enough pool, of course. If there are 80 people now that are certified across the country, and that's only Spanish, there's really no way that it could become a requirement.
Okay, great. Now, can you tell us anything about how people who took the written pilot test did overall?
That's one thing that we've had that question before as well in terms of how well they did. And the pilot exam, in terms of the way that most people look at it, it's really kind of a test exam. It's an exam to figure out what questions are going to work and what questions are not going to work, how people are doing with that. And so there weren't really results of how people did on the pilot exam, because based on how people did and what their knowledge and their experience was, then we decided to change the questions or not. So it's actually a little more complex than just getting a grade. There really wasn't a grade because that wasn't the final exam. And in our view, really a pilot exam is not a final exam, and that's why nobody was certified with the pilot exam, because it's really an exam to make sure that the job analysis and the subject matter experts were on the right track and then adjusting for it. What we have seen so far is an 87% passing rate for the written exam. So the actual exam, 87% of people that have taken it have passed it. And for the oral exam, which is a smaller pool of people, because not as many people have gone through the process, so it's probably not statistically valid yet, but I believe it's 75% of people that have taken the oral have passed it.
Okay, and what are those numbers for each of those, the oral and the written exam?
In terms of how many people have taken them, or?
Mm-hmm. Right.
We have, it fluctuates. I think right now about 300 people have taken the written exam. I think we have about 500 people, so including those 300, there's about 500 people in the process. The oral exam, I can't tell you exactly how many have taken it right now. If I had to venture, I would say 40 to 50 people have taken it. But I don't have the names and the numbers like on me personally.
Okay. What is the time for retaking the written and the oral exam in case somebody fails one of them? Is there a time limit on that?
Yes, there is. There's a time frame, so you have to wait 3 months to retake it. There's no limit as to how many times. Right now, we don't have any limit for that. And you have to retake it, I believe, within 6 months. You know, the retake, I'm not so sure. I think it's within 6 months that you have to retake it.
Okay. Does the exam cover issues related to mental health, domestic violence, or sexual assault? That wasn't actually all one question, but those are the questions that I've gotten from several different people. So it's sort of like specialized subject matter expertise.
Right, right. From what I know, from what I have from the list, no.
Okay. Is it possible to find online podcasts, reviews, interviews, or other things that might help people study for the oral part of the exam?
Well, the oral exam, for both parts, we have a version of this presentation online. We have links to a lot of the websites that can provide resources, and we have presented from the perspective of the trainer. I have actually presented a couple other people from the perspective of the trainer, so ideas of what trainers can do. But of course, a student could look at that and think of ideas for self-study, and those are all on our website. But we don't provide any training ourselves, because that would just be a conflict of interest. But we do have those presentations on our website.
Okay. How well must you do on the oral and written exams in order to pass?
Sorry, I didn't mention that. The written exam is you have to get a 75% or better, and the oral exam you have to get a 70% or better.
Okay. All right.
And that was based on
really rolling it.
And that was based on the job analysis as well. So part of determining what should be the pass rate was based on how well people did or how not so well they did on the pilot exam. So it was also another factor, because people asked it a lot. Why is it so low? It seems so low. And it was what we found through the job analysis.
Okay. If you're a native speaker and work in the medical field, do you still need to go through the registration process and pay all the fees to get certified?
Yes. If you're a native speaker and you work in the field, you still have to prove your prerequisites to us. The proficiency ones, as I mentioned, if you apply before May, you don't have to prove those as long as you have experience. But yes, because the fees are based on what it costs for us to process it, and then what we pay our proctoring sites and vendors and things like that.
And as a follow-up to that, can you distinguish for people, native or bilingual speakers who happen to do interpreting in their healthcare institutions, and people who work as interpreters? I think that some people who use a second language in the course of their daily work sometimes are not clear, or perhaps are ambivalent about whether they are interpreters in quotes or whether they are bilingual, and how might the certification process view that, and how might healthcare employers view that? What are some of the issues there?
That's a really good question. I think there is a lot of confusion. There's also a lot of different approaches throughout the country in terms of using bilingual employees, interpreters, or other staff members that can help with language access. I think that once certification becomes more mainstream, so to speak, and expected and required, then probably different employers will have to look at what they're doing in terms of their bilingual employees. Right now, some hospitals have a screening process in place for those bilingual employees, and some don't. Some clinics have a process and some don't. So it's up to the employee saying, I'm bilingual, and unfortunately some places will still use them as an interpreter. And then, of course, there's always the question, as you mentioned, of some of them liking that, some of them not. I know we have a clinic where there's somebody who always reminds us of how little she likes to interpret, even though they tell her she's supposed to. When she calls to book an interpreter, and we tell her, we can't do 2:30. Can you do 3 o'clock instead? But whether it's in somebody's job description or whether it's means that they're going to get paid more than their colleague that doesn't speak Spanish or doesn't interpret for the Spanish-speaking patient, those are all things that employers on an individual basis have to decide. This kind of certification would definitely be an asset for somebody who's working as a bilingual employee and who is used as an interpreter. And that way they could certainly justify getting it in their job description and getting a pay incentive as well for playing that role, because they're certified as such. I don't think personally that there ever will be enough certified medical interpreters in all languages across the country, and a lot of hospitals will rely on other ways of meeting their language access requirements. And as long as those people are screened and trained and following the standards of practice, then then that's what they're going to go with. And I think with certification, it'll just help standardize that more and really recognize that this is a profession and not something ad hoc. So it'll probably make everybody think twice and then look into, okay, should we try to get these people certified, or at least look into what's required and how can we fit that in with our bilingual employees.
Okay, great. A couple of questions here about certification tests in different languages. The first one is about how you might deal with the issue of different accents and dialects in a single language, for example, Arabic, in an oral exam.
Mm-hmm. Well, with regard to Arabic, we don't have the oral exam right now, but I can talk about how we do with it with Spanish. As far as I know, and I'm not an expert in Arabic, but Arabic is considered one language with different regional varieties, and Spanish is I think about the same thing. And so what we do is if there is anything in the exam that the rater is unfamiliar with, and the raters are going with a so-called acceptable dictionary, so they have all these different terms that might be used and would be accepted based on the different countries and regions that speak Spanish, because there are certainly, as we know, many of them. And if they encounter something that's not on their list, it doesn't just mean that it's an automatic error. That's when they consult the other rater, and then if they have to, they consult a third rater as well to make sure. And then if they find that indeed is an acceptable term only in Mexico or only in Colombia or Spain, then they'll add it to the dictionary and it'll become acceptable. And the same thing, I would imagine it would be the same thing with a language like Arabic that has different countries that speak it. And then when we do the job analysis and we have the subject matter experts, if we find something different, then it might be a different scenario. But right now, unfortunately, most people don't have really the luxury of asking for a Lebanese Arabic interpreter versus an Iraqi Arabic interpreter. And so the certification would be similar, would reflect that.
Okay. Two people have specific questions about wanting to know a little bit more about when, in terms of months or years, a Portuguese oral exam might be developed and when there might be an exam for Somali speakers.
Okay. Both of those languages, and then I would venture to say Arabic too, are probably going to be the next phase, just in terms of from the feedback that we've gotten from people asking about them, and from what we know of the volume of requests that are national in terms of those languages. They're growing in terms of the need, especially Somali with the large influx of refugees that are coming in. Of course, Portuguese is dear to my heart. That's the language that I speak, but that's not why we would do it. But there is a really big demand, particularly in certain parts of the country, like Massachusetts. So I would venture to say that it would be the next batch. It's really hard to talk about timelines. I would love to say within the next year, year and a half, but I don't want to make any promises either. We're saying 6 months for the next 5 languages. And then we would probably start after that. It would just depend on somewhat on funding as well, in terms of whether we can start something simultaneously or whether we have to wait and then move on to the next batch of languages. But those 3, Somali, Portuguese, and Arabic, I would say are probably in the next group of languages after this one now.
Okay. I have a couple of questions here from people who speak multiple languages and want to know if they need to do a certification exam for each language.
So if you work with different languages, you would have to do the oral part for the different languages, but not anything else. So you don't have to retake the written. You don't have to register again. You would have to, of course, prove your proficiency or your experience for each language pair that you wanted. But you don't have to take the written more than once, because the written is English-based. But you would have to take the oral for each one. And when you become certified in one, you'll have to specify that. So similar to the American Translators Association exam, where you have to specify that not only are you certified, but you're certified in a certain language and even language direction, which does not apply to interpreters, but it does to translators. You'd have to do that just to be honest and ethical about it. I'm certified in Spanish and not yet in Portuguese, for example.
Right. Okay. An interesting question here about legal liability. Does getting certification as an interpreter protect one from liability?
That is a good question in terms of legal liability. I would think, for the most part, what we've seen in other fields, I'm thinking about court interpreting, is that as long as interpreters represent their skills honestly, they're not held responsible for mistakes, because nobody's ever promising to be perfect. And so I don't believe there's anything upheld in court as to an interpreter being deemed responsible for a mistake that was made. It's a little bit different. There have been some court interpreters that were misrepresenting themselves, or the court system that they worked for didn't do any kind of screening, and that was a little bit different. But certification, I would think, would certainly help protect you from liability, because it shows really that you have the highest credential possible as a medical interpreter. The specifics of that, how that would play out, I'm not going to pretend to be an expert on that, but I would think it would only strengthen your case. And again, most interpreters, in the cases that we've seen so far, they're not found responsible for that. And the oath that you take in court is that you're interpreting to the best of your ability. A medical interpreter is doing the same thing. They're not promising that it's going to be 100% perfect.
Okay. A question here about differing certification processes. This one's specific, but I'm hoping that you might be able to expand on it a little bit. The question is, if the state of California requires and has a certification, will I be able to perform workers' comp cases with a national certification? And what I'm hoping that you can do is perhaps answer that if you're able, and then perhaps address the fact that other states also might have different kinds of certification, or other subfields of interpreting might have other kinds of certification, and how your certification process might dovetail with or complement or replace those processes.
Mm-hmm. Yeah, and we've received that same question before, so it's interesting. It keeps popping up with regards to workers' compensation hearings in California. The short answer is that it would depend on that state agency, on the workers' comp, and if they would accept national over state, which in most cases, I'm not sure why they would not accept a credential that's national versus one that's just state. But we can certainly work with them in terms of looking into what is required. I know that the state certification exam in California, their prerequisites are lower than ours, so in order to sit for the exam. So if somebody has passed the national certification process, it would sit to reason that they would pass the state one, or at least they would qualify to take the state exam. And so I know that in working with them, that's always a question in terms of, well, you're requiring more than the state of California is requiring. In terms of working with for individual employers or state agencies, some of that is, I think, a matter of time in terms of the field growing now that certification is a reality, it's accessible, and there's no longer really a need to wait, especially for Spanish. Then I think it'll start adjusting itself, and then we also can look into what kind of active work we can do in our role as a certifying body. We're not a lobbying nonprofit. We're a nonprofit 501c3, so we don't do lobbying. But in terms of working with the different organizations and talking about our certification and how that would meet their needs, state versus national. I think to a certain extent it's a personal preference. If you're in California or Washington or a state that has state certification, maybe you don't need to do national right now, but then it's a matter of it is a higher credential in terms of it being national. You can move. You don't have to, do it all over again. If you move, a second time from there, or if you move, and if you were to move to one of those states, it's a matter of finding out, I think, from the hospitals. And again, I would think that in a short period of time, we're going to see those requirements either changing or really adapting, saying you have to have state or national certification.
Okay, another question. How does this national exam compare with other national exams being developed? Is it advisable to get certified by more than one exam process?
Is it, I'm sorry, is it advisable?
How does this national exam compare with other national exams being developed? And is it advisable to get certified by more than one exam process?
Okay. So there are a couple of differences between the two national programs that are out there right now. The national board, which is the one that I'm talking about and that I'm on, is the only one that has that's actually certifying people right now. And then the Certification Commission for Healthcare Interpreters, which we heard the presentation last week, they're following the same process, but they're still piloting. I think they're piloting their exam this fall. So, I mean, that's one difference, is that it's not ready. They've also, from what I understand, the amount of languages that they're going to have might not be as wide. From what Mara was saying, they're not focused so much on doing it for all languages, but only the main languages that are used for interpreters. Their exam, and I would, as she did, I would encourage you to go to each website to look at the differences between the exams. The specifics that I know of their exam that are different is that they're testing for simultaneous interpreting while we are not, and they're testing for written translation while we are not. I think they have more questions. I don't know the cost because they don't have a price out there for the cost. So I don't know if there's going to be a price cost difference. And that, in terms of the test itself, those are some of the differences. They went through a job analysis similar to what we did. Again, they did that this year, so they're kind of following the same steps. Whether it's advisable to get 2 certifications, I think it's really wonderful actually that we're at this point in our field where suddenly we have 2, not 0. And if you're interested in interpreters getting the 2 credentials, I mean, that's gonna speak even more about your qualities and your abilities. I don't think I don't think an employer would require it, and of course there's no push from anybody to only validate one over the other. And from my perspective, we would never do that in terms of saying, we want the government to recognize only our program, not another program that's out there that's valid. I don't think that's really up to them or to us to decide, but you could get 2. I think it's really a matter of each interpreter deciding what exam fits with what they want and whether it's available and how easy it is to find a place to take it, and what credential they want to have.
Okay. We have still a bunch of questions here, and if people want to stay on for a few more minutes, I will throw out a few more of these so we get a chance to hear them and see if they can be answered. Another question that we have, well, it's kind of a follow-up to the one that was just given. Is there any plan to combine the 2 certification programs into one so that there's a single standard?
Personally, I would like to see that happen. There's no plan right now. The National Board reached out a while ago to the Certification Commission, and there was no interest on their part in really even talking. But at some point, it might happen. I mean, this was something that happened with sign language interpreters. They had, in the beginning of their certification process, there were 2 organizations that were certifying them. There was another one in the healthcare industry. I can't remember if it was pharmacy or I can't remember which one it was that had the same thing. They had 2 organizations that eventually came together. I know that it can be confusing for interpreters in terms of, why is there two, not one? Which one is better? How do I make that choice? There are also some positive things about having the two of them in terms of really, as I mentioned, I mean, there's a choice. It's amazing that now interpreters can actually look at two of them, and whereas a year ago, 2 years ago, there's nothing at all, and it just helps get the word out there. I think actually each organization's work to disseminate the details of their exams and certification with the various organizations that we both work with can do nothing really but elevate it, because more people, even it's a wider pool that find out about certification and the importance of using professionals as opposed to just ad hoc employees or family members.
Okay.
I think
another question is this a nonprofit organization? Please address concerns that a major for-profit vendor of language services is on the board.
Yes, it's definitely a nonprofit organization. We are all volunteers. We're not making any money on it at all. Most of us do not have actually any support from any financial support from our employers. So many of our interpreter members are freelancers, and there's nobody, paying for all the time that they're spending on the board. There's nobody paying for their travel when we go to conferences. That's the case with me. My employer is supportive in that I can spend a small percentage of my time, like giving webinars and things like that. But we're definitely nonprofit. We are, our fees are all based on what it costs. There's very little coming in, and funding has to be done really through other things like raising grants and things like that. It's not really primarily the fees for the test. In terms of having concerns with having a language tester, language employer, on the board, I know that is a concern, and it's basically we have all stakeholders on the board. So we do have employers. I'm technically an employer, but a language service provider is also an employer. It's no different from the Certification Commission for Healthcare Interpreters. They have, I believe, 2 different vendors on their board. It's really the same thing. There's a lot of experience with all of those vendors in terms of testing. I know LanguageLine has been testing their own interpreters for 20 to 30 years, and they really have quite an experienced department in terms of how to conduct the testing, how to rate it, and how to do the process. It's not something that they just hire anybody to be over the phone, and that was really one of the things that we were looking at in terms of it. And they're supporters, and they're not making a profit from being on the board or from having designed the exam along with PSI, because it's test design is not a profit-making profession or field. There's not money in it.
Similarly, or just slightly related to that, if you are certified under LanguageLine Academy, are you grandfathered into this process?
No, there's no grandfathering, and it's not the same exam either, which has been another thing that's been floating around. Excuse me, there's somebody at my door. I'm sorry. That's been floating around, which is it's the same exam. They just took it and they rehashed it, or that their interpreters are certified. And no, it's neither one. This is a new exam that was designed based on that job analysis, together with PSI, and their interpreters have to take it as well. So they're not the only people that are, and I don't even want to call it grandfathered in, but the only people that are receiving a credential as a CMI that did not take both exams and go through the whole process are the subject matter experts that helped design the exam, because it doesn't make sense to have them take the exam if they helped write it. So they're the only people that receive the credential. Everybody else has to go through the same thing, pay the same thing. They're screened in the same way. Their confidentiality, their name is kept private in the same way. because that's the only way really to do a valid process. And we want to become accredited as well as a certifying body, so we're following those rules very carefully as well.
And just as a follow-up to that, what is the process for evaluating the qualifications of graders of the certification exams?
There's a process in terms of looking at what their experience is. There is on our website you can find out what the requirements are to apply to become a rater, and then it's an ongoing process in terms of monitoring and calibrating what the results are and comparing, a cross comparison between what are the different raters finding between themselves and then between test takers, and it's all part of something a lot more technical and complex than I can probably do justice to, but it's not something where an individual is sent an exam and decides to come up with their own rules in terms of how to grade this person's exam. They're trained for, I believe it's 2 to 3 weeks. They're monitored, they're calibrated along with the other raters, and they go through a really intensive process, and then the whole time that they are rating, they continue to be subjected to that same monitoring process. So really, each rater in each exam is overseen by another individual as well, who's making sure that the rating is conforming to those standards, so that because the test is only as valid as its raters and that rating process. We can have a really good test, but if we don't have good raters or a good rating system, it really falls apart. So that's as much as I can say without going into more details. Even I myself, I'm not in the committee or the rating committee, but.
Okay. We do have some more questions. We will email those to you, Elena, after the webinar is over. I want to thank you again for taking the time to do this presentation for us and for all of your answers to the questions. And as we mentioned before, the information about the website, about the webinar, is available on our website, diversityrxconference.org. Webinar 11. The slides are there now along with some resource links, and the recording will be available next week. We will also be sending you a satisfaction survey, which we'd love it if you could fill out so we can learn how to improve these webinars and make them better for you. And we expect to be having another webinar later on in the fall. You, by having signed up for this one, will get information about that, and we hope that you'll join us at that time. So thank you very much for joining us on this webinar. Thank you again, Elena, and to the team of people behind the scenes here. And please feel free to visit us at our website. Thanks very much, and have a good day.
Thank you.
Thanks.
Muted.